Good afternoon, and thank you for this opportunity to present our very brief data on opportunities for anesthesiology residents and fellows in global health. I'm Evan Pivaliza on behalf of all of my co-authors from the UT McGovern Medical School in Houston. By way of introduction, our postgraduate anesthesiology education does not specifically include global health initiatives. Although the ACGME milestone project, which governs what residents should accomplish before graduation, does specifically require them to have responsibility to diverse patient populations, specifically when resources are limited, and that they would use system resources to facilitate cost-effective, safe, longitudinal perioperative care. Now, some academic departments are fortunate to have faculty that are active in global health programs, and this would inevitably lead to trainee opportunities. And we believe that this global health experience is essential to the career development of trainees and their future global health participation. And so we briefly describe our experience with such a program. Our methods were very simple. We have faculty members who participate in a biannual 1-week surgical trip to Antigua in Guatemala, who developed a process for selection of senior anesthesiology trainees to accompany them. The selection is initiated by trainee request, and with our constant feedback, we have trainees requesting participation very early, but obviously in terms of provision of anesthesia care, they do need to be senior, and they obviously must be in excellent professional, clinical, and academic standing. And preference is given to future departmental faculty or fellows, followed by the chief residents, and then the remainder of the senior graduating class. And this was important to engage departmental support, who then felt that they were investing in a future department member. Our partner is Faith and Practice, that many of you know, and they have a booth here displaying. They're a very mature, nonprofit ecumenical organization based out of Houston who provide robust in-country logistics. And this is really important for the anesthesia component of our care, as well as the surgical, is to assist with the necessary pharmaceutical supplies, disposables, and equipment that we need. And their mission is to improve the physical, spiritual, and economic conditions of the poor in Guatemala through integrated surgical, which is what we do, but also medical and dental mission trips, as well as health-related educational programs. And they really are a critical component of the healthcare provision in Guatemala. Our facility is the Obra Socialis Hermana Pedro, which is a church and a hospital all in one. And this was our all-pink anesthesia crew with 3 residents, 1 fellow, and 2 faculty. We were very fortunate to have been in Guatemala in February, just before the COVID restrictions last year. Support is generously provided by the department, who assist us with vacation or trainee relief from clinical rotations. Our hospital partner, Memorial Hermann Hospital, is exceedingly generous through their medical mission arm. They allow residents to apply for generous travel grants. And then our own departmental faculty participate with the trainees in their fundraising goals. So very briefly, over the last 18 years, we've been very fortunate to take 26 residents and 4 fellows to serve on the trip along with us. And although we don't have any specific survey or objective data, the experience has been overwhelmingly positive and life-changing by their affirmation. Many continue to serve with Faith and Practice, and at last count, that was 11. And they remain as part of our scheduled orthopedic trips each year, so that we're fortunate to be able to staff both the annual and biannual teams purely with current faculty, trainees, and then with alumni that were previous residents on the trip. We don't have data for graduates who have relocated, but we trust that their engagement from this immersion would allow them to participate in global health opportunities with alternate organizations. So in conclusion, we have faculty that are engaged in global health, which is important because that can lead directly to opportunities for trainees. We initiated a very elementary process to allow for senior residents and fellows to share their clinical skills under appropriate faculty supervision. And we believe that this immersion adds just intangible benefits, not only societal, but also to the trainee in terms of the real systems-based practice that we yearn for, in addition to their excellent clinical and academic training. We couldn't do this without our department and our colleagues supporting our time away. We are so appreciative to just the fantastic Houston-based and in-country faith and practice staff who provide this platform. We thank our surgical team leaders, Mark Wolf and Brian Parsley, orthopedic surgeons, and Pam Gallagher, who's our primary logistics organizer for their organization and leadership. We're so appreciative to this M3 conference these last few years for providing a venue to see multiple medical outreach efforts across the globe. And of course, couldn't do this without our Lord blessing all of these workers with the medical skills and the opportunity to use them. Thank you for your time.